Hello from Goshen College, where I'm one of the assistant women's basketball coaches here. This is Jamie Applegate from Inside Track Physical Therapy and Wellness, and today we're going to talk about squat mechanics. Now, most times when we talk about squat mechanics, people think of squatting on squat rack or squatting like lunge squatting, but that's not what we're talking about today. Today we're talking about squatting in action. We're not talking about squatting with weightlifting and CrossFit, but a lot of times squatting is applied to a lot of things we do in life. So for example, some of those things we do in life where we squat are getting up and down from a chair, picking up something from the floor, getting up and down from bed. More athletic or active examples would be boxing out in basketball, getting in a stance in wrestling, or landing from a jump in volleyball if you're a hitter. Those are all examples of active squats. Some of the things I want you to avoid are three big ones. These will prevent a lot of pain for you and prevent a lot of dysfunction, reasons why you need to come see me. So proper squatting mechanics, you don't want your knees to come together, you don't want your knees to go past your toes, and you don't want to lean your body forward. Now proper squatting mechanics, you're gonna try and keep your shoulders over your ankles, you're gonna try and keep your knees behind your toes, and you're gonna prevent your knees from coming together. Now this is proper form when you're squatting at squat rack, or if you're squatting for weightlifting, or things like that, or burpees, flexion jumps, stuff like that. If you're squatting for like landing from a jump for volleyball, or you're in a stance for wrestling, or you're shuffling for basketball or boxing out, you also want to do those things because those could prevent injury. The most common kinds of injury are if your knees are coming together, you're putting a lot of stress on the inside of your knee right here, your LCL, a little bit on your ACL too. If your knees are moving beyond your toes forward, you're putting a lot of stress on your ACL. And if you're leaning forward while you're squatting, that means you're putting a ton of stress on your back and your pelvis and your hips. So if you can avoid these things when you're playing sports or when you're exercising or when you're just getting up from a chair during the day, you'll put yourself in a better position. This has been your inside tip from Inside Track Physical Therapy and Wellness.